and then we'll begin. Okay, wonderful. Welcome everyone. Thank you so much for joining today's session. We have with us on Creating Careers Moving On, we have LUT, which is Liverpool University NHS Foundation Trust, and you will know them as hospitals such as the Royal Hospital in the city centre and Broad Green Hospital. So they've come on today to share some of their frontline occupations that they have within the NHS. There are 350 plus careers in the NHS, so we're trying to show you as many of them as possible over the whole year. We're going to showcase a couple of them today. Obviously, we can't show all of them, but hopefully this will give you a little bit of a taster of what it is like to work in Liverpool City region within the NHS. So I'm going to hand you over to Sharon now, and we will go from there. Thank you, Sharon.
Thank you. Hi, everyone. Thank you for joining us today. My name is Sharon Morecroft. I coordinate the work experience and organise events like this for the Liverpool University Hospital Trust. The Trust does, as Leslie Ann said, it does consist of the Royal Liverpool Hospital, Broad Green Hospital, but we've also merged now with Aintree Hospital. So we're across 3 sites and including the dental hospital as well. So welcome to our NHS career talk. Today we're going to hear from a doctor who is a registrar in renal transplants and an operating department practitioner, which ODP for short. I would now like to introduce you to our doctor, Dr. Ori Pajamo, who is a registrar in renal transplants. I'm not sure if she's ready to speak. Ori, are you ready?
Yes, I'm just going to switch my camera on. If you just give me a second, sorry.
It's okay.
So students, just a reminder, as you watch today's session, ask as many questions as possible in the chat. No question is a daft question. If you don't ask it, you'll never find out the answer. So please engage as much as possible, ask as many questions, and like I say, introduce yourselves on the chat so we know where you're from, and ready to participate fully in today's session. So we'll wait for Ori to come on.
Switching on my hotspot.
It's not a live Zoom session without a few technical issues, is it? We're used to it in this Zoom world we live in. Sorry, students, just bear with us.
If I can just have people comment, write in the comment section about what year you are and what part of medicine you think you might be interested in. So whether, or the NHS, not necessarily medicine, so whether you're thinking of becoming a doctor or you have other interests.
Wonderful, brilliant. So students, just to start us off then, if you could in the chat, just quickly whiz in the chat for us, what area are you interested in? Medicine? Are you interested in other areas of the NHS? Where do your careers aspirations lie? It could be anywhere within the NHS that you've got an interest in. Thank you, George. We've got George, year 11. He's going into college and he's interested in radiography. Okay, brilliant. Anyone else got any thoughts of what they're interested in within the NHS? Thank you, Georgia. We've got year 11 going into college. Interested in being a paramedic? Interesting. So students, what I would say is we will put the link in for our Creating Careers website. We've got tons of different NHS roles there that you can watch on demand, the chats with professionals, as well as the live opportunity that you've got here today. So don't just stop here, carry on your journey and look at our Creating Careers website, and you'll see interviews with all kinds of different NHS professionals. Okay, Daniel, thanks for that, year 11, going into history. I'm a history teacher, that's best subject in my opinion.
Any other responses?
Just waiting. Anyone else want to share what pathway they're interested in going into? Okay. We're getting ready again.
There we go. Can you see my screen now? Can you see my screen?
Ah, yes, we can see your screen. We had a little bit of feedback then, but I think it's
About that.
stopped now.
I got stuck on the motorway. So I'll tell you all about my journey into medicine, and just basically how I've got to where I am. If you have any questions, just let me know. And I'd quite like for it to be interactive. So feel free to just put any comments that you have in the chat session, and then we can address it. Because what I think is quite useful is to be able to know what it is that you want to know about working in the NHS. So I was a transplant registrar over the last 6 months. I've just moved on to a different area in surgery. So my career path, I'll tell you about my career path till date and the different parts of medicine that I've been working in. So first of all, I went to medical school in London, and it was a fantastic time. And I've included an insight into what medical school is. So medical school is a lot of studying. It is a lot of studying, a lot of exams, but beyond that, it's also a lot of fun things. So in the top left is the Afro-Caribbean Society that I was a member of. So you can see me there all smiley on my first week of uni. And then on the right over there is my elective when we went to Machu Picchu. Beneath it is when we went to Bolivia on our elective. And on the left of that was a random weekend where I went traveling with a friend. So that kind of, the reason I put these pictures in is to highlight that medical school is a lot more than what you think in terms of hard work. It is hard work, but it also gives you a lot of room to explore different things. As a part of my medical school training, I had the opportunity to also go to Japan for 3 months to do a project. So medical school is what you make of it, in the sense that it can be quite diverse. You have your exams, you have all the standard lectures you need to go to, but there's also a lot of diversity in it. Some people take an interest in sports, some people take an interest in research, some people, you know, are part of all sorts of societies. So there's a lot to do within your 6 years. It's not just studying. And then beyond that, I did my foundation years. So after medical school, you do 2 years of foundation, where you do 6 different rotations usually. And those are the 6 that I did. I did 4 months in cardiology, 4 months in general surgery, 4 months in GP, 4 months in trauma and orthopedics, and four months in geriatrics, and 4 months in gastro. And on the just on the side of that picture, again, is because I think one of the most important things about going into medicine is understanding that you can have a good work-life balance. So I've put a picture just on the side of a cake that I made in my foundation year, in one of my foundation years, because during this time I decided to set up a home baking business. I didn't always have time to take massive orders on, but one of the main things about being successful in a career like medicine is making sure you have things outside of medicine that you engage in, that keep you occupied. So for me, it was baking, and I loved it, and I still bake every now and again. But you know, whilst you're working as a doctor, you can have a life, you can do other things. For some people it's sports, like I said, some people it's going to the gym. You know, there's all sorts of interests that people have, which you can carry on having alongside a full-time career in medicine. Just to give an idea, your day-to-day work is essentially 8 or 9 o'clock, starts at 8 or 9 o'clock and should finish at 5 o'clock. There are times when you're on call. On average, I'd say once a week. As an F1, you might be on call where you work from 8 a.m. till 8 p.m, depending on the trust you work in. But where I worked as an F1, once a week we would work from 8 till 8 p.m, but otherwise most days we were done at 5 o'clock. Every now and again you have a weekend as well. So it is hard work, but also you do have time to do other things as well. And then I did my core training. excuse me, which I did down in Kent. And I did that in 2 different hospitals, and that is, so I've chosen to go down the route of surgery. At this point, if you were interested in GP, you would go down the GP equivalent of core surgical training. If you're interested in medicine, you would go down the medical equivalent of core surgical training. So that's 2 years of sort of honing down on the area that you're interested in. And also, if you're interested in psychiatry, that's the 4th route you can go down. And then finally, where I am now, so I'm currently a registrar. I'm an ST3 registrar. I've just completed my rotation in transplant surgery, which was very enjoyable. It was very exciting. It was an opportunity to, in real time, see people's lives change, in the sense that, you know, somebody goes from needing dialysis multiple times a week to a kidney being available, and you watch in real time when you transplant that kidney and you see it start to make urine on the can't work, they can't travel, they're constantly exhausted, they're at risk of lots of infections on dialysis. Can you hear me? My internet just went off a little bit.
Hi, yeah, we can hear you.
Okay, so that's one aspect of registrar surgical training that one could go into if you were interested. So there's transplant, there is upper GI, which has to do with stomach surgery. There is colorectal, which is to do with surgery of the intestines. And there are lots, there's ENT, there's trauma and orthopedics, there's a wide range. So I'm focusing more on the surgical side of things, because that's my area of expertise. But similarly, on the medical side, you know, there's the opportunity to go into respiratory, cardiology, dermatology. There are so many options. And the beautiful thing about medicine is that if you start along a certain route and you decide you want to do something else, those skills are transferable. So you can transfer onto a different route of training, which is just, you know, not a lot of careers offer that. And then one of the main things I'm particularly been interested in throughout my career is global surgery. And, you know, that's one of the things where I say, outside of your day-to-day hospital work, you have the opportunity to do other things. So I've been part of different conferences, different meetings and committees as well, where we work on projects trying to improve access to surgery across the world. So I'm part of a committee called GASOC, and it's the UK's National Global Surgery Committee. But similarly, you know, it's a bit like Doctors Without Borders, but for trainees, and not necessarily focusing on the traveling aspect of it, but more on building capacity and focusing on what the need is within the specific countries, which is a specific area of interest of mine. For example, when you look at this screen, you see, I don't know if any of you have ever been to a developing country, but when you look at this screen, those green and blue nets are mosquito nets, quite easily available, but global surgery has developed innovative techniques such as these easily mosquito nets to help with a formal procedure and protocol whereby you can to reduce somebody's hernia. And the impact of that is significant, because it means that somebody goes from being incapacitated, unable to work, unable to provide for their families, and with such a small and simple procedure, suddenly they're able to carry on with their lives, and their families, you know, their children can go to school, their families can eat, and they're working members of the community. And this is another example of a locally made space, which in the UK we tend to use the plastic ones, but in developing countries, they're not as easily readily available, they're expensive. So these are the kinds of innovative technology that I'm interested in through global surgery. And that's just another aspect of surgery outside of your hospital work that if you're interested in, you could take part in. And I've added this slide in on behalf of Mr. AJ Sharma, one of the transplant consultants, who is also part of the army, and in his spare time, so to say, he's been involved in lots of deployment opportunities where, you know, he says it's the best experience of his career. He's had the opportunity to work in different teams in different parts of the world, in different perspectives, but working as a doctor through the army. So again, that's another thing that another avenue through which some people in medicine may carry out their day-to-day jobs. So just a few questions that I had at your age. I'm happy for you to put any other questions in the chat box, and I'll start answering questions now. My first question was, will I have a life? Because I think that's what everyone thinks about medicine. They think, oh God, you know, it's the rest of my life. I'm never going to have any work-life balance. Can I even have a family? And yes, you will have a life. A lot of medical specialties are now focused on maintaining work-life balance. There's a lot of focus on well-being, ensuring the mental health of doctors and other workers in the NHS. And then on top of that, there's been something introduced called the European Working Time Directive, which means that doctors, for instance, are not supposed to work beyond a certain number of hours a week. And where that does happen, you have an opportunity to exception report and you can get those hours back. So yes, it can be hard work, but you know, the Royal Colleges and medicine as a whole, as a career, has recognized the need for that work-life balance. So there are things in place where there's a risk of losing that balance to make sure that, you know, you're protected. Why is training so long? That definitely put me off at first. I thought, gosh, I don't want to be training for years and years and years. But when you start, first of all, training involves actually working. It's called training, but you're working, you're being paid, you're going to, you have a career. And actually you realize that there's so much to learn that when you get into the middle of training, a lot of people then don't want it to end, because it means that you've come to the end of your learning and all of a sudden you're more independent, and actually you grow to enjoy that safety blanket of being a trainee, so to speak, where you're working fully, but you're very much protected by the systems in place, your consultants. Will I be poor? That's one of the major concerns I think a lot of people have because of what's in the news about junior doctors earning very, very meager wages. To reassure you, what's usually in the news is not reflective of what junior doctors tend to take home. On top of your normal 9-to-5 job, you get allowances for things like being on call. You get extra pay for any hours you work beyond sociable hours. So very often you find that actually your pay is supplemented far beyond what's advertised in the media. And I've also mentioned about spending time with your family. We recognize, and a lot of people in medicine recognize that it's important to have that balance. So yes, and will I get a place at medical school? So that is probably one of the greater concerns I suspect some of you may have if you want to be doctors. And what I can say in terms of advice for getting places in medical school is work experience. Making sure that your personal statement has been read and reviewed by as many people as possible. You've taken feedback on board. You've gained work experience, and make sure you talk about the work experience that you've had in your personal statement and at your interviews. So the work experience doesn't have to necessarily be in a hospital. It doesn't have to be in a GP practice. It can be at a nursing home. It can be at a charity shop. It's just showing that you are able to show compassion. You're able to, put yourself in a position where you're caring for other people, and that it's something that you're passionate about. Because ultimately, medicine it's a vocation. It's a career, but it's primarily you have to care about people to be a good doctor, to find fulfillment in it. So that's what I would say you need to make sure shines through in your personal statement and at your interviews. And that's the end of my presentation. Any questions? I'm just trying to find the chat box.
It's just at the bottom.
Yeah, there we go.
if you found it.
Does anybody have any questions? Can you see my camera? No, sorry. There you go. I thought I was showing off the whole time. Does anybody have any questions?
Leslie Ann, you're on mute.
It's a classic Zoom, isn't it? I think you did an excellent job there, putting some preempting student questions at the end of that presentation there. So students, if you do have any questions, please put them in the chat. Just from my point of view, listening to your story, things like transplant surgery and global surgery, entering a career like that or any new career must be daunting. There must be an element of quite strong nerves and almost fear there. How do you deal with that pressure?
I'll be honest, there is. I think first of all, going into medical school, you think, oh my goodness, this is, you know, the first day you go into it and you think, oh God, I'm going to be a doctor. And then the first day you are a doctor, most F1s go onto the ward and they're terrified. And the moment you walk on, you know, the nurses who you work with have been nurses for 20, 30 years. They take you under their wing, like almost like their baby. So you go on terrified. And by a week in, you're like, actually, this is perfectly okay because the system is prepared for new doctors. So there's a lot of additional support on the wards for doctors. There is, the nurses are wonderful support. And the one thing I'll say is if anyone does go on to become a doctor, if a nurse ever suggests to you, are you sure you want to do that? Listen. Or if they suggest to you, don't do that, listen. They've been doing it much longer than we have, and they have a wealth of experience. They're the best teachers, honestly. So I think, you know, when you start to realize that there's so much support at the various levels that you're going into, even though it may feel daunting, quite often when you get into it, you get used to it, and you know, it's not as scary as it seems.
Yeah, and I think that's really useful for students because we get the feedback that a lot of them are really keen about the rewards of working in the NHS, but are nervous about that other side of, obviously you're going to see some difficult things to deal with, and it's really reassuring to know that there's an amazing support system there.
There really is.
Forward with a career. I think we've got a question here in the chat asking about GCSE grades, about that are needed, the subjects and the grades that are needed to get into this career?
So I went to secondary school in Nigeria. So my grades would have been the equivalent, I suppose, of A's and A stars mostly. But I can tell you about A levels. So A levels that I took, this is by no means prescriptive of all medical schools, but the A levels that I took were maths, further maths, biology and chemistry. And this was 10 years ago, gosh. And I had A's in all of them, but that was when you didn't have A stars. So I think at the moment, a lot of medical schools want A stars because then we didn't differentiate between A's and A stars. So what I would advise, which I did, and I found really useful, when you get to the time of applying, go through all the medical schools you think you're interested in. One of the main things you realize is that some medical schools are focused on students. They prefer to have students who are interested in sports because that's their area of expertise. Some of them are very academic heavy, like Cambridge, Oxford, Imperial, UCL. So if you look through the prospectus, you will find what they're interested in. If you look through the prospectus and there's a lot of focus on sports, for instance, then if that's what you've got on your portfolio, then apply to those ones. If you're more of an academic medical student, apply to the more academic ones. Interestingly, when I applied, the two that I got interviews from, and the ones I got rejected from were kind of the opposite of what you'd expect. I got rejected from Leeds and Sheffield, and I got interviews from Imperial and Oxford, which is sort of the opposite of what you'd expect. But that was because I was quite academic, and Leeds and Sheffield wanted people with extracurricular activities. So I wasn't their target medical student. So if you read through the prospectus, you'll find which medical schools are geared towards what your strengths are. And then you also find what grades they want. Some of them might be all A stars. I suspect Imperial, UCL, Cambridge might be. Others might be, you know, 1 A star, 1 A and a B, because they're more geared towards people with extracurricular activities.
That's really interesting what you picked up there on rejection. Is that something that you feel prospective medics, something that every prospective medic is probably going to face? And what would you say
Yes.
about dealing with that?
I would say my first rejection, I cried. I cried for a few hours, I would say. And then I stepped back, I reflected on it. So it was my first interview, it was with Oxford. I reflected on it and I thought, you know, what could I have done differently? And I realized that my preparation wasn't adequate. So then that meant that when I went into my second interview, I had put in, you know, 5 times the amount of work into reading online what medical school interviews are, preparing and practicing those with people at home. So when I went into my Imperial interview, when I walked out of it, I was confident that I had a good shot. Whereas the first one, the Oxford one, I came out of it and thought, oh gosh, what's happened? You know, so what I would say about rejection is it's something that you will come across, whether you go into medicine, work in the NHS, any job. What you need to be able to do is feel the pain. If you're sad, cry, be sad, that's okay. But then step back and be truthful with yourself and reflect on it and see what you could have done differently, what you're going to take away from it so that the next time.
Yeah. Yeah, and I think that's such wise advice. And I think one thing that I always like students to hear is every single person deals with rejection at some point.
Oh yes,
everyone,
definitely.
Everyone, it's tough, but it happens. So we've got a couple more questions, just two more questions in the chat. So we've been asked about work experience while you're studying for your A levels. Is there something you recommend, and what kind of direction would you go in?
So a lot of people get, bogged down with getting work experience in hospitals and GP practices. It's not so much where you do your work experience. What's more important is what you get out of it and how you show that. So you could work at a charity shop, and it's seen more favorably in your personal statement than if you work at a hospital. It's what you say you've got out of it. First of all, they want to see longevity. So they want to see commitment. So if you're wherever you're working, you don't have to go there every day. But if you can dedicate time, maybe on a Saturday morning for an hour or two every 4, or in a care home, so you got out of it. So it's not just about sitting in with the GP and saying, oh, I saw a few people with headaches and tummy aches. It's about going around the multidisciplinary team and showing that you spend time with a receptionist. You went to understand how a GP practice works, if you're in a GP practice. If you go to a care home, you get involved, you actually look after the residents, you help them go, you feed them, help with getting them to the toilet, that sort of thing, and really showing that you're able to go in and get involved and show commitment to what it is you're doing. So it's not as important where you work. What matters more is, that you can show your personality, that you're a compassionate person, you're dedicated, you're hardworking, and that you're reliable as well. So those are the kind of things that would work. And someone's asked about volunteering with St. John's Ambulance. Yeah, by all means, that would probably be a really interesting experience. But again, don't focus too much on the name of where you're working, because if you put on your CV or in your personal statement, I volunteered with St. John's, teamwork, commitment. So those are the kind of buzzwords that you need to show. Those are the skills you need to show through whatever you've done, whether it's your grades, whether it's your work experience, whether it's your interest in medicine. You need to show those those skills.
Wonderful. So I suppose we've got one more question in the chat. And what was the one key piece of advice you'd give to a student who are starting on the journey and thinking, I'd like a career in healthcare?
I would say don't let anyone discourage you. There's a lot in the media about the NHS, healthcare, but it's a very fulfilling job. I've come off a set of nights and just driven down home, and I still love my job. You know, I think if you're interested in healthcare, it's a calling, so to speak. And if you're interested in it and you have that passion for it, you will find it very fulfilling. You know, there are nurses, doctors who've been working in the NHS for 30, 40, 50 years. And when you hear them, when you see them interacting with their colleagues and the fulfillment they get out of the job that they do, you know, you can tell that this really was for them. So if you're interested, pursue it. If you ever get to a point where you think, you know, you want to do something else, you can always do that. I think a lot of people are terrified that if they start along a certain career path, they can't change their minds. Life is too short to remain stuck on one thing. If you try it out and you decide it doesn't suit you, you can always change your mind. So if you're interested, pursue it for as long as you're interested. And the moment, you know, you may not be interested anymore, similar with any career, you have options. So don't let anyone put you off. And don't listen to the media. It's not true.
I love that advice. Sharon, how are we doing for time? Have we got a bit more time? Are we ready for?
I think we're ready to hear from David, if that's okay.
Okay. So
Yeah.
thank you so much, Ori. I really enjoyed the session. I'm sure.
Thank you for having me. I'm so sorry I was stuck in my car. It's
Thank you for your time.
Morning. No worries. And good luck to everyone. If you have any other questions, I'm more than happy for you to pass them on through Sharon if anyone has any.
That's wonderful. I'll put our email address in the chat, and students, if you have any follow-up questions, we can get them answered.
Fantastic. Bye, everyone.
Thank you.
Thank you. Bye. So Sharon, who do we have next?
Here's David.
Good afternoon.
Hi.
Hi, David.
Hi. All ready to go?
We are, yeah.
Okay. My name is David Lyon. I'm the Senior Practice Educator for Theatres here on the Aintree site at the Liverpool Foundation Trust. I was just jumped onto that call right at the end. I believe, was that one of the doctors who was having that chat with us? The best advice she gave there was pursue your dreams, and if you change your mind down the line, there's absolutely no problem with that whatsoever. I started off when I went to do my A-levels. I wanted to be a lawyer. Did A-level law, decided it wasn't for me. Then I was going to be a history teacher because I really love doing history A-level. Actually went to university, got halfway through a history degree before changing my mind completely and becoming a nurse. I'd been working part-time in the hospital because my mum was previously a theatre sister in recovery. So I'd been working in the hospitals from the age of 17, taking bloods, pushing trolleys, doing whatever was asked of me. And I really enjoyed it and decided to pursue it as a career. And I've worked my way up a little bit. Joining me on the call is Alex Wellings, one of the practice educators who works in the team with me. And she's an ODP herself, and hopefully she'll say hello.
The host stopped or something. The host just stopped it. What does that mean? Okay. Hello.
Hi.
Hiya. Sorry, the video won't come on. Oh, might do now. Hiya, I'm Alex. I work with David. I'm one of the practice educators here at Aintree, and I'm an ODP. So I look after student ODPs and qualified ODPs in theatre here at Aintree. Right, come on now.
Okay. Can everybody see that screen?
Yes.
Okay, so we're going to discuss the role of the ODP So obviously ODPs work in the operating theatres. It's a profession that not a lot of people have heard of. I've been doing these talks in local colleges, and everybody always puts their hand up and says they'd like to be a nurse or a doctor or a midwife or even a paramedic. And then when you ask them what an ODP is, nobody actually knows. But obviously I've done this presentation a couple of times, and at the end of it, we've actually had a few people who've decided it's the career for them and they've chosen to pursue it. Okay, so what is an ODP? An ODP stands for Operating Department Practitioner, and it's a profession that is registered with the Health and Care Professions Council, and you can become an ODP upon completion of the accredited course. Operating departments accessible 24 hours a day, and so you're required to work at weekends, evenings, and at nights, as well as throughout the day. It's a multidisciplinary professional role, and it cares for patients through all aspects of the perioperative journey. And the operating department practitioner plays three main roles within theatres. They do anaesthetics, they assist the surgeon during surgery with all the instruments, and they can also work in the recovery room afterwards as the patient wakes up, and making sure that they're safe, pain-free, and ready to go back to the ward areas. So on the anaesthetic phase, I've put one of our anaesthetic machines there. The day begins by ensuring that the environment and all the equipment is safe and adequately prepared to accept the patient. And it includes checking the medical equipment, such as the anaesthetic machines and the vital signs monitors, as well as ensuring that all equipment is clean and safe to use. In the morning, we complete the first step of one of the 5 steps to safer surgery, which is the surgical brief and the team huddle, because communication with all members of the theatre team is vital. So with that meeting, the surgeons, all of the theatre staff, anybody who's going to be involved in that surgery during the day will meet, and they will do team introductions. They'll clarify everybody's roles and responsibilities. They will discuss the patients and the theatre list, highlight any risks to the day or hazards that may occur, and they'll also check for any misunderstandings, obviously to try and make it as safe as possible. Often, the anaesthetic ODP is the first person that the patient meets, and it's important that they establish a good rapport with them from the outset and make them feel at ease. And once they're in the anaesthetic room, more checks take place, and the ODP will apply vital signs monitoring to the patient. They'll assist the anaesthetist while they administer the anaesthetic type of choice. And once the patient is anaesthetised, the ODP ensures the patient is safely positioned on the operating table and that they're kept warm and secure throughout. If the ODP is working in the scrub role, at the start of each day, they'll prepare the equipment for the procedure, ensuring that the theatre environment and the equipment is checked and its safety ensured. They'll ensure correct surgical instruments, packs, and extra equipment are available for each procedure. And they'll support the surgeon who is carrying out the operation at the operating table. And they have to wash their hands in a methodical manner called a scrub and put on a sterile gown and gloves. They ensure the availability and sterility of all the equipment, ensuring it's accounted for at all times, because you don't want to be losing a swab, a blade, and instruments inside a patient. And often at this stage, the patient will be unconscious, and therefore it's the scrub practitioner's role to ensure that the patient remains safe throughout, maintain the dignity, and ensures confidentiality and treats them with respect. They act as a link between the surgical team and all the other parts of the theatre and the team in the hospital. And they anticipate the requirements of the surgical team and respond effectively. So essentially, the surgeon cannot do the surgery without you. You obviously know all the instruments. That is your responsibility. You're in charge of them, and you get to know and learn the procedures as well, so that when the surgeon needs something, you already anticipate it and have the instrument ready to hand them. Surgery also includes the role of the circulating practitioner. So in this role, the ODP assists the scrubbed ODP by passing any supplementary items as and when they are required by the surgeon. These items are passed in a way that maintains sterility and doesn't compromise patient care. And at the end of the operation, it's important that a formal count of the instruments, swabs and needles is undertaken to ensure the safety once again. In recovery, they will support the patient on their arrival. They'll monitor a patient's physiological parameters. They will provide appropriate treatment until the patient is recovered from the effects of the anaesthesia and or the surgery. And they will assist the patient in order to ensure they can be discharged back to the ward. And they will evaluate the care given during each phase. So just before we go on to how to become an ODP, the ODPs are also often part of the resus team in the hospital. They'll go to all of the arrests. They'll go down to A&E, obviously because they're experts in looking after the patient's airway. So again, they'll assist the anaesthetist there. They'll go on all the bleeps, so any emergencies around the hospital they go to as well. So since 2015, the ODP course is degree-based, and it's offered at numerous institutions across the country. So here in the Northwest, it's offered at 3 universities, Edge Hill University and UCLan in Preston, which deliver a purely direct entry degree-based course, but also Bolton University, which offers not only a direct entry model, but also an apprenticeship model as well. So employers can send staff onto that course as well. And providing you undertake the HCPC approved course, you'll be eligible for professional registration upon completion and to work as an ODP. So what to expect? ODP training is 60% work placement and 40% theory based, with the theory work being delivered at the university campuses through lectures, group exercises, often some e-learning. During the pandemic, there's been a lot of e-learning, and you'll undertake clinical assessments as well as theory assignments related to your practice. English, very, very important. Obviously, you need verbal communication skills because you'll be dealing with patients, relatives, other organisations, and a range of other staff, including healthcare assistants, nurses, fellow ODPs, physios, and doctors. Written communication skills because you're filling in care pathways, patient documentation, and good reading skills because you'll be able to follow complex instructions, read and evaluate patients' notes, check consent forms and for procedures to ensure patient safety. So there's various ways of being able to do this. You can go and do an access to HE diploma, where you need a minimum of 5 GCSEs of grade 4 and above, including English and maths. But unfortunately, they cannot accept equivalent qualifications such as functional or key skills. However, if you don't have the GCSEs, don't let it be a barrier to realising your aspirations. There's a range of options available. So numerous academic routes. There's now, you can go and do, first of all, your health and social care level 2 and level 3 apprenticeships to get yourself the qualifications you need to apply to do the degree course. And you must also have a clear DBS. So obviously, because you'll be dealing with patients, it's important that you haven't got yourself into any bother which would affect your potential to register. The typical entry requirements to an ODP degree is a typical offer is 112 UCAS points, which is the equivalent of an A-level BBC. You can have health and social care level 3 apprenticeships, there's BTEC extended diplomas, and obviously your access to HE diploma as well, which will get you the qualifications to get onto the course. Many operating department practice courses will expect you to have some type of healthcare experience when you apply. So in the months before UCAS opens, try to undertake either some voluntary or paid work in a healthcare environment. And you might be able to get a part-time job as a care assistant in a care home, work with St. John's Ambulance, volunteering, or even on a hospital ward. But university admissions know that this isn't always possible to get that experience. So just have some working knowledge of a care environment and person-centered care. So obviously, when you go for the interview to get onto the course, you've got a good understanding of what is expected, because obviously a lot of our new ODP students do come fresh out of college and haven't worked in the environment previously. You'll undertake placements in a number of different hospitals. Usually you're going to be based in the same one for the majority of training. But as we're an adult setting, we'll spoke our students out to to go and work in the likes of Alder Hay, so they get the children's exposure, and also some obstetrics, so delivering babies, etc. And they'll also work in some outreach areas such as intensive care, A&E, and the hospital wards. And in the clinical environment, you'll be providing direct care to patients under supervision and working collaboratively with ODPs, nurses, and assistant surgeons. So we've obviously got some of our first year ODP students who this time last year were completing their A-levels, and 6 months down the line, they are stood at an operating table with a consultant surgeon performing surgery. And I've put the file in the chat, and there's a link to a video to watch. I don't know whether we want to go through some questions first, then we can leave you with that video. If there's any questions in the chat. Anybody wants to ask anything?
That's wonderful. We'll start, students, as we did with earlier. If you can put any questions in the chat. David, if you wouldn't just mind putting your camera on, and I'll start us off with, thank you. And I'll start us off with some questions. Just as I was listening there, earlier on in the chat, students had said some of their interests in the careers within the NHS. Some students are interested in radiography, others becoming a paramedic, etc. How much does your role involve teamwork and working with NHS members of staff who are in all those different occupations and departments?
Massively so. Every day, it's teamwork on a daily basis within an operating theatre. It starts with the cleaning staff who actually come and clean the theatres at night to make sure that the environment is safe to practice in. And I think for anybody coming into healthcare, it's important to have respect for everybody within the team, because everybody is vital to taking part. Obviously, on a daily basis within the operating theatre, it's kind of a strange environment. Obviously, my background, I qualified as a nurse. Sorry, I don't know why the camera off. I qualified as a nurse, but then decided I want to work in the operating theatres. So within theatres, we have scrub staff who trained as nurses, and also people who trained as ODPs, but we all perform similar roles. So we call ourselves theatre practitioners a lot of the time. But obviously, you've got your surgeons, you've got your radiographers coming, especially as we're a major trauma centre, obviously in theatre on a daily basis. And then post-operatively, when the patients go back to the wards, the care plans often involve physio involvement. And then obviously we link into the labs quite a lot as well, because we'll be sending bloods or we'll need results from them during surgery. So everything interlinks.
Yeah, so no matter what occupation you're interested, or the specific role you're interested in within the NHS, it's important that you all share those core values. We've just got a question through about students who are training to become ODPs. How do they cope the first time that they see an operation? I should imagine that can be difficult.
We try not to throw people into the deep end. So obviously we have a 3-year plan for our students ODPs. So we're fully aware that some of our ODP students who have come fresh out of college may never have been exposed to the healthcare environment before. So we'll often start them in our elective care centre, which is a lot of the smaller surgery. How do students cope the first time they see an operation? We do tell them the first time they're in surgery, if they feel faint, to make sure they fall away from the table, not towards it with the patient on. But most are well prepared, because obviously the university do a lot of work before the students actually come out to placement with what they can expect. People always think that surgery is going to be a lot like they see on TV, and there'll be a lot of blood. If there's a lot of blood a lot of the time, the surgeons wouldn't be able to see what they're doing. So it's a lot more controlled environment than you might expect.
Is it usually a calm environment?
Most of the time. Sometimes it has to be to make sure it's safe for the patient, and good levels of communication. And that's why we have so many safety checks across the day, to make sure that at every stage we're stopping and thinking about what's coming next. Are we safe? Is the patient safe? and do we know what to expect? It can get not aerated, heated at times in terms of where we're under pressure. But I think as a team, we understand those situations where in a theatre on a daily basis, there'll be conversations that go on during the day. There'll be conversations that go on. It might be a case of what was on TV last night. Those conversations go on because it's a normal working environment. But there are times when things need to be focused and concentrated. So we'll have full focus on the attention, and the surgeon will often lead that and let us know that they need complete quiet.
Yeah, no, that's brilliant. So students are probably aware, but just in case you're not, different hospitals across Liverpool City region have different specialisms, don't they? So, for example, Liverpool Women's will specialise in female health, and maybe the Walton Centre will be specialising in neurology. How does your role differ depending on what hospital you're working from and what the specialism of that hospital is?
It can differ massively. Obviously, all of your basic skills that you learn during your training will allow you to work anywhere. But obviously, when you go to a specific hospital which has specialities, you will learn that speciality specifically. So obviously, I did my nurse training here at Aintree. When I qualified, I actually went to work over at Broad Green Hospital, doing elective orthopedic surgery. So I do a lot of knee replacements, hips, shoulders, broken bones, and the likes. And I see there was a question in the chat about which of the parts of the 3 disciplines do me and Alex like the most. So I have to say I don't do anaesthetics because I'm a nurse. So I just do scrub, and I can work in recovery if I wanted to, but my speciality is scrub. I could go and do a 9-month top up to be able to do anaesthetics, but I specialised. I went to education. So within the scrub discipline, my speciality is orthopedics, and people tend to get somewhere they like. So you might during your training have an exposure to paediatrics and want to go and work in older hay. So you can be an adult. ODPs aren't children or adult trained. You'd be an ODP, so you could go and work in theatres in a children's hospital as well. I've worked at Wiston previously to this, and the big speciality at Wiston is obviously it's the burns hospital. So obviously burns and plastics. So they'll do a lot of that surgery there. But a lot of staff will specialise in many different areas. So all of our staff on the Aintree site, not only will they do a rotation around trauma and orthopedics, they'll do the emergency surgery, they work in general surgery, they might work in head and neck. So staff are multi-skilled. Alex, do you want to answer on what your favourite specialty is?
I'm just on mute. Hiya. So yeah, I've done quite a lot of surgery within the orthopedic trauma department. So here at Aintree, it's very big on trauma because we're the trauma site for the Northwest. So lots of polytraumas coming in, all major stuff. So I'd say orthopedic trauma quite a lot. We also do a lot of liver surgery as well, which is very interesting on the anaesthetic side. And we've got a head and neck department, the MFU and ENT, and that's a big speciality for lots of difficult airways. So you get a lot of vast experience here, in both specialities.
Just for students listening and that they may not be fully aware of some of the terminology, orthopedic trauma, could you just tell students what that is, please?
Well, it ranges from, it's basically all your broken bones. So it can be hips, your femurs, broken ankles, broken arms, broken pelvis, broken ribs. There can be, doesn't have to be orthopedic trauma either. There's a lot of maybe gunshot wounds or knife injuries. It's all big major stuff, vascular stuff as well we do here. So
Wonderful.
It can be a bit gory.
So another student's just asked, has there been a massive difference to operating theatres since COVID's come into place? Maybe how they're set up or how they're run?
I think obviously during COVID, a lot of the elective lists so the planned surgeries, a lot of them were cancelled and that was nationally as well. So a lot of we've got a big backlog of surgery at the moment across the country. And that was a lot of that was because the ODP skills were needed elsewhere. So a lot of our operating department practitioners, they were actually redeployed and they got sent to work over in the intensive care units, obviously because their skills in terms of being able to look after patients' airways and complex medical equipment and the anaesthetic machines, etc., meant that their skills were able to be utilised within the ITU setting. So our ODPs are really multi-skilled and a really highly valued part of the hospital. Obviously, financially, the pay is the same as the nursing, so it's on the same scale as the nursing pay scale. So there's no difference there. And obviously the opportunities available to ODPs are pretty much just as plentiful as they are for nurses as well.
Yeah, we've had some cracking questions today from students. We've got another one here from Georgia who's asked, do you think the media portrays medical jobs well in a fair way? Is it always like what you see online or the news, the TV, or what you might read about?
No, I think a lot of people who will work in a hospital won't watch Casualty on TV, for example, because you'll get frustrated just sitting there going, that wouldn't happen in real life. It doesn't work like that. You don't go from being in a ward area to go through 2 doors and end up in an operating theatre. It's a lot calmer than you may see on TV. We at times work like a well-oiled machine. Obviously, a lot of the staff have worked in the hospital for many, many years, and you can go between hospitals and the structures are quite similar between them. So when you do move around, maybe for promotion, etc., you're able to blend seamlessly into the team. I know you see online quite a bit and in the news about how the professions are underpaid, etc. But compared to a lot of jobs, it's not a badly paid profession, and it gives you plenty of opportunity to go as high as you want to. As I said, I started working in a hospital at the age of 17, trolley pushing and taking bloods over a weekend, just as a little part-time job. I'm now in quite a senior position in the theatre management team here. And to be honest, I've got another 30 years ahead of me. So I'm hopefully going to keep progressing a little bit. I've just seen in the chat, Julie Jones asking what the salary's like. So in the NHS, we have what's called an Agenda for Change pay scale. Registered staff, so this will include ODPs, nurses, physios, radiographers. They will start as a band 5 on the Agenda for Change pay scale. So the starting salary for a newly qualified nurse, ODP, etc., is £25,000 a year, and over 3 or 4 years, you go up that pay scale based on your level of knowledge and experience. And I think the top of a band 5 at the basic level is about £30,000. But that's base salary, so that doesn't account for the money you'll earn extra by what we call enhancements. So for working on a Saturday or working on a Sunday or working out of hours or nights, you'll get extra money. So a lot of our newly qualified ODPs can quite easily earn over £30,000 in the first year of working.
Wonderful. Just on that topic there of like shift patterns that you're linking it to pay, but maybe Alex will direct this one to you. What's it like? I suppose this is within any job you may do in the NHS. What's it like dealing with long shift patterns, or even you may be at an operating table, you may be there for a very long surgery, or work long days, working nights, weekends. What's it like dealing with that, and any tips or tricks that you have to help you along the way?
Everything. Personally, I find nights quite hard work. I don't have to do nights anymore, luckily, in this job, but you just sort of have to get yourself in nighttime mode. And here in Aintree, they do a shift pattern over a month. So you do a month of nights. Obviously, you wouldn't work every single night. You'd do a few nights a week, but you have to get yourself in that mode. Sleeping in the day can sometimes be quite hard. But I find as you're a bit young, if you're a bit younger, maybe they're a bit easier than when you get a bit older. Or some people prefer to do nights. We have staff that just work nights all the time. It just depends what you like, really. I'm just trying to think. And then weekends. So if you worked of a weekend, you'd have days off during the week. So some people find that easy, you know, for childcare and stuff like that. It's a good mix of all different types of shifts. So you wouldn't be expected to work 7 days on the trot, and then, you know, you generally do 3 or 4 days a week, but they might be slightly longer days, which that does suit some people as well, because then they'd get more days off, if you see what I mean. So working the weekends and the shifts, a lot of people find good for childcare.
Yeah.
So
you can adapt to it. Basically, you can adapt to it, and you feel like all those difficult shifts, they're not coming in a big long line, so you can maybe get them out the way and then have the shifts that suit you more. Yeah. Sorry, David.
I think obviously a lot of our staff, we have got family commitments, so people do find their way into jobs which suit them. So in our elective care centre, for example, a lot of the surgery is day case surgery, so they'll work generally in a daytime between 8 and 5 p.m. Whereas on the wards, it's a lot more early starts, late nights. But theatres, I'd say maybe 75-80% of an ODP's role is in what we call office hours, like between 8 and 6 during the daytime, because obviously that's where most operations take place. Out of hours, it tends to be a lot of just emergency surgery. But obviously it is a 7-day service. So staff will work over the weekends, but again, a lot of the elective surgery is currently Monday to Friday. Obviously, as we discussed earlier, there are waiting lists and they've gone up. So obviously there's a lot of people in the country who are waiting for operations. So I think eventually it will become a 7-day service, but obviously you'll still only work 37.5 hours per week.
Yeah, interesting. So I think there's no other questions coming up directly in the chat from students. So I think we'll just finish it off on, we always like to ask this question on creating careers. It's about your time in school. And I know on your presentation, you mentioned the importance of English to this job. If you both think back to your time in school, because we always like students to think, what's the point of going to school? Obviously, it's of high importance and we want students to recognise that. And specifically how your school subjects can link to your future career. So if you think back to your time in school, what skills or knowledge or anything at all do you feel that you took away from school that you use in your life or in your career today?
I think, first of all, English and maths are absolutely vital. If I was going to suggest anything to somebody in school at the moment, it would be concentrate as much as you can on your English and maths. Because potentially in the future, that could be the subjects that hold you back, because to progress on a lot of courses, they ask for the equivalent of a C, I think it's a grade 4 these days, to be able to progress. So we find we have a lot of staff who are more than able to go and do the training or go on to do future courses, but they have to go back and resit their English and maths to get the grades that they require. So if you can get them while you're at school, and you have to be there, do it, because in years down the line you'll find that might be the thing that could hinder you if you haven't got the grades that you need. If you do want to go into one of the nursing or medical professions, obviously having a good knowledge of the likes of biology and chemistry, it will always come in handy. But listen, my A levels were history, media studies, computing and law, and I've become a nurse. So you, as I said, speaking with the doctor earlier, you can go and change along the way. The important thing is to get good grades, especially in your A levels, to be able to get onto these courses. And I think the other thing is IT. I'm probably just of the generation that we did have Windows when I was at school. So I did IT GCSE, so I got to use the likes of Microsoft Excel, Word, PowerPoint, etc. To the point where I can put together a small PowerPoint for the likes of today, to be able to deliver a session. All these things that you probably do on a daily basis of making the presentations and things in IT at school, most jobs you go into now will expect you to have really good IT skills, and I think it's becoming a bit of a prerequisite. I think everybody has good IT skills these days, so it's important that you like doing PowerPoints. Alex?
Yeah, I agree. All subjects, especially IT, because they sort of expect you to know how to do things as well now on a computer without having a certain amount of training on it. So yeah, IT, English and maths, kind of thing. That's it.
Wonderful. Thank you so much, both for sharing all that. I know students will have found that so useful. Students, we're at the point of the end of the session with the ODP profession. We were today expecting a third speaker, but unfortunately, as you may find if you go into a career with the NHS, things can pop up at any minute, last minute. That's the nature of the job. So unfortunately, she will not be able to join us today. So we will close the session in a moment, so you can maybe finish for the day a little bit earlier.
Yeah.
Yeah.
Yeah, we've still got the video to watch.
Oh yeah, yeah.
Well,
I'll put the video on in a moment. Dave shared that video. Thank you for reminding me, Sharon. Students, if you are interested in anything else about ODP, again, send it through to the Careers Hub at growthplatform.org. Send any questions in and we'll get them answered. I'll put that link again in the chat. And we actually have, again, earlier I shared the link to our Creating Careers website. You can actually find an episode there on the ODP profession if you're interested in finding out more. Again, I will put the link up. Now, before I share the video, just a reminder that next Monday, so Monday the 14th, I think it's from 10 till 3, is it, Sharon? Is that right?
It is, yes. Yeah.
We have another live session, which is all about allied health professions. So there'll be several speakers throughout the day talking about allied health professions. I will put a link to what allied health professions are in the chat, so you can have a little look beforehand to prepare you for that. So what I'll do now is I'll just share my screen and we'll finish off with the video that Dave wanted to share. Can everyone see that full screen?
Yeah.
Brilliant.
Hello and welcome to this short video on the role of the Operating Department Practitioner. Operating Department Practitioners, or ODPs for short, are an important part of the Operating Department team. They work alongside anaesthetists, surgeons, theatre nurses and healthcare assistants to ensure every operation is as safe and effective as possible. ODPs provide high standards of patient care and skilled support throughout the perioperative journey. The ODP role is quite diverse, working within the 3 areas .
So let's try that again. Looks like something's gone wrong with the video. Typical Zoom. I think something went wrong with the connection. 1 minute, I'll try it again. If not, I'll put the link in the chat and we can.
Working within the 3 areas of the perioperative journey. There are some overarching qualities and skills that are necessary for the ODP. These include the ability to communicate effectively and to accurately complete patient documentation. This is essential to ensure the safety of both the patient and the perioperative team. As an ODP, you could be working as an anaesthetic practitioner, assisting the anaesthetist, as a scrub or circulating practitioner, assisting the surgical team, or as a recovery practitioner.
Hi Craig, I'm Tracy. I'm going to be helping looking after you today in the anaesthetic room. Just going to do a couple of checks before we take you around to theatre. Can you just confirm your name and your date of birth for me, please?
Craig Johnston, 14th of the 10th, 1988.
Okay, have you got any allergies that you know of?
Not that I know of.
Have you got any pins, plates or prosthesis?
No.
No. Okay.
As an ODP, Often, the first time you will meet your patient will be in the theatre reception area. At this point, excellent communication skills are paramount. To enable you to plan the care of the patient, it is important that you very quickly establish a rapport and gather as much information about the patient as you can. It is the role of the ODP to be satisfied that they have got the correct patient and that patient is aware of what they are coming to theatre for. Once the ODP has completed the patient checklist, they will then continue to the anaesthetic room. It is the role of the ODP to ensure that the environment is safe and adequately prepared to accept the patient. This includes checking medical and surgical equipment, ensuring from an infection control point of view that the environment and equipment is of an acceptable standard. When taking the patient to theatre, it is important to maintain their dignity on the corridors and ensure that they are not too cold. The patient will have previously met the anaesthetist either at pre-op clinic or on the morning of surgery.
Just going to pop this blood pressure cuff on the top of your arm. Okay. That's it. And that's just going to go tight now.
Once in the anaesthetic room, the ODP will apply monitoring to the patient. It is important to explain what you are doing. The anaesthetist will need assistance in inserting a cannula to the patient and applying a dressing to secure it.
If you can just make some fists in and out like that.
Once all the baseline observations have been taken, the anaesthetist will proceed to anaesthetise the patient. The type of anaesthetic delivered will depend on a number of variables, including type of surgery and the patient's medical condition. This patient is having a general anaesthetic. This will include the anaesthetist pre-oxygenating the patient prior to administrating the anaesthetic. The anaesthetist will have to place a tube in the patient's trachea. It is the role of the ODP to ensure that the correct tube is selected and that all the equipment necessary to assist effectively is checked and prepared. The ODP will then pass the equipment to the anaesthetist and offer any assistance required. Once the patient is safely anaesthetised, they will then be taken into the operating theatre. The theatre environment will already have been prepared to accept the patient by the practitioner who is undertaking the scrub or circulating role. Once the patient is in theatre, the anaesthetic ODP will ensure that the patient's monitoring has resumed and that they are safely positioned. They will also ensure that the anaesthetist is satisfied that the anaesthetic is continuing as planned. The scrub ODP will wash their hands in a methodical manner. This is called scrubbing up. Once the scrub ODP has finished scrubbing up, they will then have to put on a surgical gown and gloves. This is a technique that requires practice. Once the scrub ODP is gowned and gloved, they can then prepare the equipment required by the surgical team.
3 Ramply sponge holding forceps.
There are numerous types of surgical instruments, and these come on trays that have to be organised and counted to ensure that every instrument used is accounted for. The same principle applies to surgical swabs and needles. Ultimately, it is the joint responsibility of the scrub ODP and surgeon to ensure that whatever equipment is used is accounted for. Once the scrub ODP is at the operating table, they are reliant on the rest of the team to provide them with supplementary items that they need. These will include dressings, drains and surgical swabs. These will all be written on a count board for the scrub practitioner to see throughout. Throughout the course of the operation, the ODP will pass instrumentation, swabs and sutures to the surgeon as required. The ODP is responsible for ensuring that all equipment used is accounted for. At the end of the operation, it is vitally important to undertake a formal count for all the instruments, swabs and needles that have been used. Once all accounted for, it is up to the scrub practitioner to inform the operating surgeon that all swabs, needles and instruments are correct. The surgical drapes will be removed, maintaining the patient's dignity at all times. At this point, the anaesthetic ODP will assist the anaesthetist in maintaining the patient's airway and ensure that the patient is receiving adequate oxygen via the appropriate device. The recovery room will have already been prepared in the morning to ensure that all equipment is available and working. This is the area where nearly all patients, regardless of the type of anaesthetic they have had, will go to for the immediate period after their operation. The anaesthetist will hand over the patient into the care of the recovery ODP, giving details of the operation, type of anaesthetic, observations and drugs given intraoperatively. Whilst the recovery ODP is receiving the handover, they will be ensuring that the patient's airway is safe, and they will also be applying monitoring to the patient. The recovery ODP will need excellent airway management skills. Once the patient is breathing adequately, the recovery ODP will commence documenting their patient's vital signs on their observation chart. These are done on a regular basis until the recovery ODP is satisfied that the patient can be returned to the ward. Prior to the patient leaving recovery, a certain criteria need to be met.
Hi Craig, you alright?
Once this criteria has been met, the ward staff will often come to recovery to accompany their patient back to the ward. The recovery ODP will give a detailed handover to the ward staff.
So let's get you back to the ward now.
The ward staff will then continue to monitor the patient throughout the rest of their stay. Throughout the patient's perioperative journey, they will be cared for by a multi-professional team, many of whom will be operating department practitioners. Throughout the patient's episode of care, there are basic principles which will be observed. These will include being treated with respect and honesty, having their dignity maintained and ensuring confidentiality throughout. It is the role of the ODP to ensure that these principles are upheld. Thank you for taking the time to watch this video on the role of the operating department practitioner. I hope that this has given you an insight to the diversity of the role and the personal qualities required of an ODP.
Okay, wonderful stuff. Thank you again, everyone, for coming on today's session. Thank you, Sharon, for organising it and getting all those wonderful speakers on. I'm sure students have took loads away from today's session. As we said, email us if you have any questions. The email's in the chat. The link to AHP professions and what they are is also in the chat and ready for next Monday's session. Please do join us. If students have got any other questions, please put them in the chat or email them to us. But if not, we will see you again next week. So thank you for joining. Bye.
Thank you. Bye.